Hi, I'm Dr. Mark Sikowski from the Safe Baby System. Today we're going to talk to you about IVs, what it is, why you need to get one, some good locations to get one, and how to make the whole process as painless and safe as possible. So when you first check into labor and delivery, one of the first things they'll do after they give you your gown is to start your IV, your intravenous. That's so that you could get salt water fluids, as well as to get any medications and to deal with any emergencies that arise. For instance, if your uterus starts to contract too frequently, you might need medication like terbutaline to stop the contractions for a short period of time and let the baby relax and catch his or her breath. Different locations they could start your IV could be actually near the knuckles where there's a vein, if the vein is big there and there aren't veins elsewhere. On the back part of the hand, sort of in the middle, where you can see a couple veins popping out there. Those tend to disappear as it goes up into the forearm. On the side over there, there's usually what's called the intern's vein, meaning everybody has one. It's one of the main veins running from the hand up back through the arm to the heart, and it is usually visible. On this location of your arm, usually not very good places to put an IV. It tends to be smaller than they look and quite painful. Sometimes you'll find veins in the forearm. Those are good if you have veins pop up. As a last resort, they'll put it in the crease of your arm, also called antecubital vein. Everyone's got two big veins there, but it can kind of limit your motion and flexibility. Remember, after delivery, certainly, you're going to want to be holding your baby, and to do that you have to bend your arm. That's one time when they might put an arm board on and sort of tape your arm straight so you can't. So how can you reduce the pain with your IV? You want it inserted in the correct location. That can be difficult to tell you ahead of time sometimes because you want to go with the best chance of success. But an IV that's located near or across a flexible joint, like your wrist or your arm, the place there is going to have some motion. And the more the little tube moves back and forth within the vein, the more it's going to irritate and cause pain. Another way to reduce the pain of IV insertion is they can use a teeny needle to numb up the skin first by injecting it with local anesthetic. That will sting slightly for a couple seconds, but you won't feel the bigger needle going through the skin to enter the vein. Certain medications will cause pain when it's running in. A lot of the antibiotics and even some other medications like anti-nausea medicines can burn for a short period of time as it's running in. Other things which can be painful with your IV include a blown vein, which is where there's been an additional hole made in the vein and blood or fluid starts to leak around it. Your hand or arm will start to swell up around that part. That would be important to tell your nurse or doctor immediately because you want to stop the infusion and you need to replace the IV. So here's some different ways to clean your skin before insertion of the IV. Proper sterile technique is very important in preventing infections, which are not uncommon. You have a little square of gauze that's soaked in alcohol. You have an iodine-containing solution that leaves the skin a little brown after it works, and you have to actually wait long enough for the solution to dry for it to have its full antibacterial effect. You also have an alcohol chlorhexidine sponge that has the highest antibacterial effect for the longest period of time, and that would be the best solution to use. You want it covered with a sterile occlusive dressing like the clear plastic that keeps it sterile, prevents moisture from getting on it, but allows the nurse or doctor to make sure and check that it's not getting red or infected or having other problems. After they insert your intravenous and before they tape it, commonly they'll put a little antibiotic ointment at the site. It can either be brown in coloration, which would be an iodine-based antiseptic, or clear, and the IV should be labeled with the time and date so they know when to change it out. An IV should only be in for 48 hours, sometimes to 72 hours, but should not be in longer than that because that will greatly increase the chance for skin infection going into the bloodstream. So let's talk about the equipment. The first thing, of course, is your IV catheter or needle that they're going to use to insert the catheter. They come in different colors, which really represent different sizes, and that varies according to the manufacturer's brand. But typically they'll do an 18 gauge IV so that it's large enough to give you fluids rapidly in case you were to bleed. Well, typically they would put in an 18. Occasionally, if you have really small veins, they can put in a 20 gauge, but the fluid will run slower through it. How can you tell that it's running well? Well, when it's wide open, you should be getting the IV drip chamber going drip, 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 or even preferably a steady stream of fluid. When the IV is running fast like that, you actually may feel cold in your arm because the solution is room temperature, which is colder than what you are. Sometimes they'll put it through a warmer, a fluid warmer, so then it would be entering your body at pretty close to body temperature, and you won't get that cold, slightly painful sensation as the fluid is running in fast. Sometimes if you're in early labor, they'll let you walk around with what's called a heplock. That's just a small, short extension tube from the IV that leads to a cap that they will sometimes flush a little bit of heparin to make sure it doesn't clot, but that way you can be mobile and you have the emergency access in case you need it, but that's at a point when you don't really need a lot of fluids or medicine at the time. Also, if you do need to receive fluid rapidly, they can use a pressure bag, even something as simple as a manually inflated bag that pressurizes the fluid so it'll run in faster, or you could have fluid run through a rapid transfuser. These can be life-saving when you really start to bleed and hemorrhage. You should make sure that there's one available at the hospital you choose to deliver at. Most hospitals will place even routine IV fluids onto a regulated pump now, and these create all sorts of noises and beeps. If the machine beeps, just make sure to alert your nurse right away so that they can fix it. The beeps can be most annoying, and it's usually nothing, but you don't want a problem if you're receiving a medicine that needs to be closely regulated, such as oxytocin. Another piece of equipment or accessory you might encounter is called an arm board. If they have to put the IV across a movable joint, like in your wrist or in the crease of your forearm, they may put this soft or not so soft board under your arm and tape it to keep your arm straight and not moving. So here we see a small bag of salt water. It's connected to a little spike that goes in a little drip chamber. So off. There will be a slow drip. There will be a faster drip. That will be wide open. Anti-reflux valve so it doesn't go backwards. You have an injection port. If someone's going to give you medicine through the injection port, make sure that they wipe it off with one of those alcohol wipes before injecting to make sure that it remains sterile. There's a little clip there that you can use to occlude the soft plastic tubing, and then there's a little light blue roller clamp. Right now it's in the closed position. You would open it up all the way, and it would be wide open or partial, and you could get a slow drip. So they're going to tape the IV to your arm, and there are 3 different types of tape. There's sort of a sticky, silky looking tape. There's a not quite as sticky paper tape that some people are less sensitive to on the skin. And there's a clear plastic see-through dressing that they can put on it. Usually they'll put the clear plastic dressing on top of the actual IV insertion site so they can check it for bleeding or redness, signs of infection. If you have any skin sensitivities or allergies, you want to let your nurse know before they're starting the IV. So here we see where the IV insertion site is taped down with the plastic occlusive dressing, which is correct. But when the IV is taped in this fashion, anytime you move your hand, you're going to create motion because across the wrist because it's fixed in 2 places. This would be a great way to have it taped. Now the IV catheter is stable and it's not going to move when you move your hand back and forth as much. It's taped so there's nothing crossing over or pressing the path of the vein. Your tubing here is on a little bridge, or a medical term would be omentum. So again, that's not going to kink, it's going to flex with you. A lot of times I see patients who come and they have taped incorrectly, where it could cause intermittent or irregular flow, which again can be dangerous when you have certain medications flowing through that need to be going at an even rate, like oxytocin. So here are actually 3 errors in taping. The first is there's not enough slack and the tubing is kinked. This is going to severely impede flow. You don't want the IV tubing to cross over where it's infusing, because that will apply some pressure and obstruct the flow. And again, if you obstruct the flow, some medication can, it's called extravasate, but go out of the vein into the tissue, and that will burn and sting and blow up. And you don't want to have stuff directly taped to the skin that way. It's going to create an impression. If you have that for several hours on the skin, it'll get red, and you can even get breakdown. And it'll be, as you move, you're going to get a tendency towards more kinking of the IV at that site than when you have that little elevated bridge or omentum on it. So 3 key points to remember. 1, they should choose a good location for the placement of the IV. 2, it should be properly taped and secured so it doesn't cause you pain and restriction. And 3, if you have any questions or problems or see anything going on that you're not sure about, ask your nurse or doctor. Have a safe, healthy, and pain-free delivery.